Hello everyone, my name is Yuritsa and I wanted to do this video so that I can share my experience and my journey with herniated disc that has pinched my nerve on my left side of my leg, resulting in a microdiscectomy surgery which I had 3 days ago. Before my surgery, I did go to YouTube and I saw videos of other people who have had their surgery and their experiences, which was really grateful for me or helpful for me going into the surgery. So I too wanted to create a video so that I can share my experience, from my perspective. A little bit about me. I started having the pain at the beginning of May of 2015. Prior to that, for at least 10 years, I have had mild sciatic leg pain. I noticed it after I had my daughter in 2005. I was a thin girl with a big belly, and I remember having back issues during my pregnancy. After the pregnancy, every now and then I would have, the pinched nerve, and had taken physical therapy and, bed rest or narcotics, to try and relieve the pain, and eventually it would go away, and I'll be okay. But in May of 2015, I just woke up one day and from bed, and I had excruciating leg pain, which became severe in the next couple days. It was to the point where it just throbbed, even if I was just laying down doing nothing. Extreme throbbing from the behind my buttocks all the way down my leg. I didn't really notice any back pain. It was all leg pain. Walking was very difficult. Sitting was excruciating. So I ended up going to the emergency room, and they did an x-ray on my lumbar and, told me that, everything looked good and more than likely I possibly herniated a disc, but they wouldn't be able to tell me for sure because I would need an MRI, and that would need to be approved through my insurance and through my primary care physician. So they even mentioned to me if that's the case, they really don't recommend surgery. It's not successful most of the time, and that it leads to even more surgery. So, the emergency room doctor was very discouraging regarding any, surgery if that was indeed the issue. So I went to my primary care physician, and she did examined me and noticed that I was pointing more towards my hip where the pain was coming from. So she sent me for another x-ray, and that came back that I had arthritis on my left hip. So that was her diagnosis, that it was just arthritis, and sent me to an orthopedic doctor. I went to the orthopedic doctor, and he sent me for a hip injection and for a bone scan, to determine, whether that would alleviate the pain, and if not, then we would know that it's not my hip. So I did get the hip injection, and it felt good for maybe a few hours, but then by the end of the day, the pain was right back to the way it was before. The bone scan eventually came back normal, no fractures, no deteriorating bones or anything in my hips. So his next step was to set me for an MRI. So, I did get it approved through my primary care physician and my insurance. Had the MRI done. And then about, a week later, I went to my orthopedic doctor to discuss the results. And sure enough, he said it's clear as day. I have a herniated disc, my L5 S1 disc, and that was causing, pinching of my nerve. And, he said it was about a medium-size hernia. So, he told me what my options were, either, continue taking NSAID drugs and, taking it easy and hoping that it'll, get smaller, maybe some physical therapy, or, he mentioned surgery, if I felt that I couldn't take it anymore, that I do have that option, due to the size of the herniated disc. So, being that I was in pain since May, and now we're talking June 11th when I finally got the diagnosis, I could not bear the pain anymore. I had to stop working. Everything was extremely painful, so I opted for the surgery, and he referred me to a really good doctor. After I was referred to the surgery, my consultation took about a month. So here was another month of just, incredible pain and not much mobility and just kind of stuck at home. But when I finally saw the neurosurgeon, he reviewed my MRI. He let me know that, I do have a hernia, nothing impressive, but it's enough that it's causing that pinched nerve. And that what he could do is, schedule a surgery to do a microdiscectomy, relieve some of that pressure on the nerve. And I went for it. I said as soon as possible. I just couldn't bear another day with the pain. So my neurosurgeon consultation was on a Wednesday, and he scheduled my surgery for that next Monday. So it was very quick. I did all the preoperative lab work, and sure enough, by Monday at 5:45, I was at the hospital, ready for my surgery. So day of the surgery, I went in, got registered. It was pretty quick. They called me in, they got me changed into my gown, took one more lab work, and sent me into the preoperative room where they hooked me up with the IV, explained the process. I talked to the anesthesiologist, let me know exactly what they were going to do, and just let me know what the success rates are. They did warn me that, I could experience paralysis, and, being under anesthesia, there's the risk of death, and, so many other things to worry about, but they did assure me that those are minimal, but not zero. So, I felt okay going into the surgery. So, yeah, 7:30, I was out. I had the surgery done, and by 11:30, I was out of the operative room. I was in recovery. When I woke up, I moved my left leg, and I had no pain whatsoever. It's like nothing, like I've never had pain in the first place. I can feel just a little bit of discomfort in the surgical site, but nothing major. Definitely better than the leg pain I'd had for a few months. So I was in recovery for about an hour, and then they took me to another room where my family was waiting for me, and from there I got to sit down. And they make sure that you're able to go to the bathroom, that you're able to eat, and that you're able to walk around for a little bit before the doctor sees you. And he did, like a strength test on my left leg, pushing against his arm or pushing away, and I had good strength, back on my leg, which was great. So after another bout of antibiotics, they sent me home. I was good to go. Came home, got my medication, some painkillers. They're going to give you some muscle relaxers. They may give you some suppositories, stool softeners, and, because of the narcotics. He also gave me some vitamin C and antibiotics. So, I got all the medication, went home, and just took it easy. The first day, I went home. Honestly, I felt so good. I just wanted to walk around all day. But, I did notice that the more walking around I was doing, the more pressure and pain I was starting to feel on my surgical site. So, take it easy. Don't push it too much. So, I lay down for most of the day, continue to take my medication as I was directed. The one thing that was the worst thing out of this whole experience, the whole surgical experience, was the scratchy throat. While you're under, they put a breathing tube down your throat. And once I woke up, I really had this terrible scratchy throat, which caused me to cough a lot and scare me because the coughing caused pressure in my abdomen, and I felt that I was, going to herniate my incision, because I was coughing so much. So it was pretty bad the first day, where it's almost like you were getting sick. My eyes were tearing. I couldn't barely breathe because I would get that itch on the back of my throat. The second day it was much better. What I did the first day is I just did shots of honey. I did gargle with warm salt water. Every little thing that I could do to kind of alleviate that, and it did help. But the second day was much, much better. It wasn't as scratchy, but it was still a little a little bothering me still. So I continued the warm salt water gargle. I continued the honey, but it wasn't as bad as day 1. So day 2, day 2 was a little hard because I could now really feel the pain from the incision side. It was very hard to get out of bed. You really need somebody to grab you and help you get out of bed, because doing the pressure to get up yourself, you're putting all that pressure on your back, and it hurts, and you don't want to cause any damage there. So you definitely need somebody to help you pull up. What I did is, my husband had to work, so I asked him to put a chair in front of the bed so that I can just grab the back of the chair and use that to hoist myself up without having to do too much pressure in my abdomen, and that really helped me. But yesterday, day 2, was difficult again. I could really start to feel the pain from the incision, so I continued to take my medication. The muscle relaxer does help a lot as well. I took my first bath yesterday, so that's a really big deal. You can't get the incision wet for 3 days. So I just had my husband help me out, and with a wet towel, just got in the shower and just try to wash my areas without getting anywhere near my back or my incision. So you're going to need some help from someone, that first couple days, at least those first 3 days, to wash and shower without getting your incision wet. But again, yeah, it was difficult getting in and out of bed yesterday because the incision hurt a little bit. Just soreness here and there, but again, 80% much better than what I was before. Again, my leg, no pain at all, not even any ghost pain. So I'm still very grateful. I'm glad I went through this surgery. Today's day 3. I woke up feeling great. Again, my husband's not here. I was able to just get up myself using the chair. I'm walking around, and I noticed that I'm not as stiff and my back is not as sore as it was yesterday. I feel a little bit more flexible, but again, you got to take it easy. I'm still taking it easy. I'm still taking my medication, my muscle relaxer and the pain, the narcotic. And, my goal is to just sit for as much as I can, but every now and then get up and walk. You want to make sure you walk for a while, just don't overdo it, and then sit down and lay down for a little bit again, and then for another hour or so, and then get up and maybe walk for another 10 to 15 minutes, because that really does help. So again, here's day 3. I feel like $1,000,000. I can't wait to get back to my everyday routine. And just a little history, I really can't say what caused my herniated disc. I am an active person, but I don't do anything too heavy lifting or anything. I'm a call center trainer, but I am, a mom, I'm a wife. So after my 8 hours of work, I come home, I cook, clean, do everything I need. I'm very high energy, so anything I could have done, whether home or at work, could have led to this happening. Or like I said, it could have just been something from my pregnancy that just worsened throughout the years. So it can happen. And I was very scared going in, because even other doctors were telling me the surgery is just not worth it. But I'm glad I didn't listen, and I'm glad that I took the chance, because I feel great, and it's great to feel back to normal again. So I'll share some more videos as my recovery continues. I know I'm going to be out of work for at least a few weeks, and I have to do very minimal lifting in these next few weeks. So I'll continue to share my journey, and hopefully this will be very helpful for someone else who's going through the same experience. So don't hesitate to share any comments. And again, I'll share some more videos as time goes on. Thanks, everybody.